This is about the weirdest public service announcement I've ever been involved with, but Dr. Philip Brown, a good friend of mine, brought his tape measure to show you what social distancing is about.
What we're doing right now at New Hanover Regional, and I'm chief physician there, we're doing a lot of preparation, and that's really what we need to have happen in the community. This has been a really fast changing pandemic. Nothing like this has happened in our country since 1918. And this 6-foot physical spacing is really important. And I think one of the key preparation things we have to think about is how to maintain that so we slow down the spread of this virus. The virus is just trying to find a host so it can survive and so it can spread. And our job is to not be that host. And so that means don't gather together in close groups. When you are outside doing things you need to do, maintain a nice 6-foot distance. If you come in contact with different surfaces, wash your hands, because we know that this virus can live on surfaces for several hours. We do need to maintain community connection, but we need physical spacing, and the two are really different. As we go through this epidemic, we just have to figure out how to be creative about what social connection looks like.
And I know that you're also now president of the North Carolina Medical Society.
Yes, sir. And we know now in our state the pandemic is a little bit different because we have community spread. That has occurred in the eastern part of the state in Wilson County, but we don't have it yet in New Hanover County identified. So again, we're still in our opportunity phase for how long can we prolong that community spread. So physical spacing, hand washing. And why that's important is because as the spread of this virus goes, if it goes slowly, then we'll be able to take care of people who get severely ill. Because we know about 20% of the people who get the virus will become sick enough to need to be hospitalized. And maybe 6% of those people will require intensive care and ventilators. We want to be able to treat all those people who need that level of service, but if they all hit at once, we simply don't have a big enough facility to do that.
That's why it's so important that we try to keep the curve down, not get the spike that we've seen now in Italy and other places, but keep it down so that if somebody does have to go to the hospital, the resources are there, the healthcare workers are there that could take care of that individual.
But we still have to take it seriously.
Sure.
This is not about locking yourself up in your house, because you have to be able to go and get food to eat. You have to be able to check on friends, neighbors, and family who are at high risk, perhaps older or with medical conditions like hypertension and diabetes. But if we honor the 6-foot boundary and wash our hands, we make a huge difference in what the spread can be, and we still have a chance to be able to meet the needs of every individual in our community who needs that level of care.
This is not to panic, but to be vigilant.
Absolutely. This is definitely not the time to panic. Our individual choices right now can control how severe this disease is. But it is an invisible enemy. We can still beat it by taking some real common sense precautions like hand washing, 6-foot distance, and not gather together in small groups. And once we get it controlled, our community, like we do after every other disaster, will rally back together and figure out how to make it going forward.
Well, I just want to say thank you, Philip, for everything you folks have been doing. You guys are on the front lines of this pandemic. You're the point of the spear. I know you're giving us a lot of good information that we're passing on to our citizens, and I want everybody to adhere to what Dr. Philip Brown and the health professionals are telling us. Please take care of yourself. Do the social distancing of 6 feet. Wash your hands. Listen to the authorities, and we'll get through this thing together and be safe.